Hi, I'm Dai Chung, Chief Medical Officer of Joint Pediatric Enterprise of Children's Health and UT Southwestern Medical Center. And welcome to the In the Know video series. Good afternoon. We're here today with guest Dr. Sushmita Yallapragada, Medical Director of Neonatal ICU at Children's Health. We're here to learn more about programs that we have at Children's Health and about Dr. Yallapragada, all the great work that she and her team are doing. Good afternoon.
Good afternoon.
Well,
thanks for having me.
Absolutely. It's a pleasure having you, and thanks for taking time out. So tell us a bit about yourself first, and perhaps even NICU as well as the fetal program that you have large part sort of role in kind of where we are today.
Absolutely. So I am the medical director of the NICU here at Children's Health, and I have been a part of the Neonatal-Perinatal Medicine division for the last 6.5, almost 7 years, and I'm a very proud member. We have a large group full of very talented physicians. Our QIP in neonatology is fetal to 5. So our fetal program is a comprehensive program that is largely consultative and partially interventional. So when there are women in the community who are pregnant with fetuses that have any kind of anomaly, their obstetrician or their MFM can refer them into our program. Once they are delivered and they come to our NICU is a level 4 ICU, which is a state designation from the state of Texas that is assigned to NICUs that have the highest level of care. So infants that come to our NICU have everything they need under one roof. We have every medical and surgical subspecialty. We have a comprehensive laboratory and diagnostic capabilities. We do offer a lot here in the unit and all of the really comprehensive care that a family might need. And once they graduate from the NICU, we are able to move many of them to our follow-up clinic, which is our Thrive Clinic, which provides not only pediatric follow-up, but it also provides developmental follow-up.
Well, you just described the whole spectrum from a fetal to 5. That's quite many years of many different opportunity for the infant to children being able to receive care here. What is really the fetal program, and why is it so important for moms with certain fetus with certain diagnoses, and having a program like what you described is so valuable for them receiving the best care?
The fetal program is really a gateway for these families. There are families from all over the region who come to our program. They meet with a variety of different people who can really map out what the journey from delivery to discharge might look like. And I think it really gives families a peace of mind. We really are there to provide them with guidance and reassurance. We take them on tour of the hospital. Some of them will only be in the ICU for a couple of days. Some of them are with us for a couple of months or even longer. And so we become part of their family and part of their day-to-day. And so learning about them and understanding their needs and their desires for their child, their goals of care from very early on is a really important resource for the families.
It's an incredible program as to really being able to offer a sense of some relief with what's to be expected from moms with their fetus with a variety of conditions. So what amount of sort of a work had gone into stand up a fetal program dating back decades ago?
Our fetal program really, the inception was probably about 15 to 17 years ago, and it initially was entirely consultative. And now, over the last 5 years or so, we've been in this beautiful fetal center. And so the moms have a one-stop shop. They come in, they get valet parking, they get a separate entrance so they're not walking around the hospital. They come inside our fetal center, they sit in one room, and all of the specialists come to that particular room. And the fetal program actually has put us in a very different level as compared to our peers. The fetal center is something that level 4 NICUs across the country strive to have. It's what we feel is standard of care now because this is what the families deserve. And we are also part of the Children's Neonatal Consortium, which has a specific group for fetal programs. And so we are constantly contributing to that group and learning from that group, developing new protocols within that group so that we are providing what we think is standard of care and even beyond.
So with all the great resource and collaboration, babies are delivered, let's say, in your NICU. You mentioned earlier about being a level 4 state designated or AAP designated NICU. What does that really mean?
A level 4 designation is given by the state of Texas. Level 4 is the highest level you can achieve, and it includes a very strict amount of qualifiers to meet the criteria. We also have a very robust quality program within the NICU, which is a very large part of the criteria to meet for a level 4 designation. And that really is where I think we shine the most, is that within our NICU locally, in addition to the hospital and how we integrate within the system, our NICU collaborates well together. We collaborate with them in a way that I think is truly special here, especially compared to other places that I have either trained or been a faculty in. I think we have a very open, honest, and candid kind of communication between all of us. And so all of those criteria and more is what really makes our level 4, I think, more like a 4+ in a very unique setting.
If you can kind of share with me a handful of unique programs, offerings that because of the expertise and resources and great people that we have here, that babies are able to get care here, but perhaps no other place that can get that such a level of great care.
Absolutely. We in the NICU are moving towards a more systems-based approach. So no matter what your child may have or what disease, what illness, we have a group of people that will focus specifically on that. For example, we have a short gut team, babies that need to be on specific nutrition, TPN for long term. We have a neonatologist, a GI doc, social workers, and a whole team of people that are entirely focused on that. We have a congenital diaphragmatic hernia team. Again, is composed of physicians, nurse practitioners, bedside nurses, and social work teams that will help while the baby is admitted and then help as the baby transitions home. We have a really robust chronic lung disease program, which I'm very proud to be a part of. We actually see chronic lung disease patients from all over the region more recently, and I think we're growing and evolving. It's a really great partnership between us in the NICU, pulmonology, our ENT and tracheostomy teams, social work, and so there's an entire group per complex child that is able to transition them home as well.
So for those babies that are here for 8 to 12 months, what kind of resources are required, and it must take a huge amount of lift to get the families to be prepared and get ready to take these babies home, right?
Yeah, absolutely. So we have an entire discharge team, and it's comprised of our social workers, our case managers, and really our developmental specialists. So at a certain point, once we feel that the baby is medically ready, we start transitioning to more neurodevelopmental care. So the medical care, obviously we take care of, but then we really ask our developmental specialists to help the families. And then we also have a checklist for discharge, which includes parental CPR, parental education. They have to meet a certain criteria to say that they are adept at taking care of complex patients. And then we provide all of the follow-up. So we call all the clinics and make sure that there's follow-up for these patients. And then we call their primary care doctor, their pediatrician, and we make sure that they are aware of all of their complexities.
In the NICU program, what are we known best for?
I think that we are known best for our comprehensive care, that we are there, we are in front of them, we are calling them if they're not at the bedside, and we are including them in the care. And so that family-centered approach is something that we get really great feedback about. So I think from the family perspective, we are really known for that. From a medical perspective, we are an evolving and growing field. So I am one of 35 plus neonatal ICU faculty. Every single one of them is fantastic. They're dedicated and talented, and they love taking care of babies and their families. We meet as a group every week, but we're constantly meeting when there are things that come up along the way.
What's to come in fetal program in the near future and years to come?
So really building a fetal center of excellence is our goal, which will require, again, that trifecta and collaboration and that multidisciplinary dedication, which we already have. We have the talent, we have the people, we have the space, and I think now it's just putting it all together and being able to provide the next level of care with interventions.
That's great to hear. It's truly a teamwork. With all those great work, I mean, do you find any time for personal or family?
Yeah, I have 3 children, 5, 3, and 1. And then I have a husband who's an interventional cardiologist, and so it is a busy life at home as well. But I really think my professional life really augments my life at home, and I think they both inform each other.
Well, thank you very much for taking time out in your busy schedule to chat with me and with us about your programs and you as a star in our children's health in UT Southwestern. It's really inspirational just to watch the growth of fetal program and where we are from a NICU and all the great things that we're doing.
Thank you so much. Thanks for having me.